My name is Jill Ferry, and I am a medical provider at Murtu Medical Center. I started my family practice at Murtu in 1995 with a desire to educate women on health maintenance as well as diabetes management, and became very active with our diabetic educators, and my practice grew rather large as I participated in educational classes for diabetics, as well as giving some presentation on women healthcare needs throughout the community. I am currently practicing full-time in a family practice setting, but I also enjoy working in the emergency room as well as taking care of patients in the hospital setting. A few of my life experiences include taking care of one of my patients who was a close friend of mine as well as a colleague, and she was a nursing friend. She was diagnosed with an advanced stage of ovarian cancer in 2010 and unfortunately passed away in 2014 from her disease. Nadine Kinkle was her name, and we became very close through her course of therapy. I recall having a conversation with Nadine about disease processes and how we were taught during nursing school and medical school on looking for differential diagnosis and looking for disease management and how to treat that, but we were not taught how to educate patients regarding the symptoms and signs. After that conversation with Nadine, it really set home that I wanted to change my practice into more of a teaching environment. I wanted to educate my patients more on disease management, but health maintenance and how to listen to their bodies. I am actively involved yearly with Nadine's desire to continue to educate this community on symptoms of ovarian cancer. Not only am I a medical provider, but I'm also a family member, and I was recently touched by another experience of a rapidly hidden cancer of leukemia. My mother fell ill to an unknown reason in the fall of 2016. She collapsed on a Saturday morning, and we transferred her to an emergency room and ultimately had to transfer to a higher facility. 2 days later, she had a bone marrow biopsy, and the very next day, my mother passed away from an advanced stage leukemia. I think it's easy for patients to have a symptom and ignore it, thinking it's something else. In both situations with my mother and Nadine, those symptoms were there, but they both thought that these symptoms were something else and something minor when they were not. I feel a strong desire that we need to teach our next generation of healthcare providers, whether it be a physician assistant student or nurse practitioner student, and occasionally I've had medical students shadow me as well. I truly believe that if cancer is caught in earlier stages, we will have many more survivors.